Welcome. Today's topic on Insider Med: would you take a pill proven to reduce your risk for heart attack and death? You might be surprised. Before we get started, a quick reminder: the information discussed today represents perspective and is not medical advice. It seems almost all of us are interested in medical advances that reduce our chances for disease and improve longevity. Yet when these advances actually present themselves, a number of us who could benefit from them do not actually take advantage of them. This includes lifestyle choices, vaccinations, and even advanced treatments for cancer and heart disease. There are a number of reasons for this, and they're worth exploring, because one thing is certain: no matter how beneficial a medical advance might be, if you do not pursue it, you will gain no benefit. Today, I'd like to explore a recent study related to heart disease to gain some insight on these issues. This study looked at pharmacy and medical claims and identified over 600,000 individuals with known atherosclerotic cardiovascular disease. In these individuals, there is clear agreement of medical experts, and has been for over a decade, based on extensive medical research, of the benefit of high-intensity statin treatment. Statins are pills taken once daily and are classified as low, moderate, or high intensity based on how much they can lower LDL cholesterol, which is in turn determined by the specific medication and its dose. Decades of research have documented both the safety and efficacy of these medications. Somewhat surprisingly, only 23% of the above patients were on the appropriate high-intensity statin regimen. Another 28% were on either a low or moderate statin regimen, and 50% were not taking any statin at all. This is noteworthy because the latter individuals already had documented heart and vascular disease and were likely aware of the serious and potentially fatal consequences of their condition. It should also be noted that the rates of statin and high-intensity statin use in this study are lower compared with other prior studies, where approximately 80% and 50% of patients with atherosclerotic vascular disease, respectively, are receiving statins and high-intensity statins. Nevertheless, even using the latter estimates, a large number of patients are not receiving the optimal treatment for their condition. This then begs the central question: why are so many patients not taking a treatment proven to be effective, safe, easy to administer, and relatively inexpensive? While there are many potential factors, a well-written accompanying editorial suggested three major categories to explain the above findings. First are physician factors. Simply physicians failing to initiate or intensify therapy when the medical literature and clinical guidelines clearly demonstrate benefit to the treatment. The second are patient-related factors, and those would include things like medication side effects, and surely this accounts for some of the patients not taking statins, but is unlikely to account for the majority of the findings. The third are categorized as social network factors, and this would include misinformation from social media and other sources, which focuses on side effects or other unproven considerations and not giving appropriate balance to the medical benefits. This leads to the next question, which is: how do you improve the situation? And quite simply, not easy. Suggestions and expert commentary included additional physician education, team-based care, promoting smart clinical decision support tools, and identifying trusted sources of information for patients. Unfortunately, most of these suggestions are already in progress, and improving such efforts, while clearly a worthwhile goal, is easier said than done. So maybe you find the preceding information interesting, maybe you don't. But perhaps the most important question is: what are the practical implications for you? And there are significant practical implications of this study beyond the treatment of heart and vascular disease, and they include the following. 1, make sure your physician is up to date and offering you the best testing and treatment options available. A number of other studies suggest this is often not the case, even with specialist medical care. Having a low threshold to seek second or even more additional specialist opinions on significant medical issues, or if your condition is not improving as expected. Some second opinions are available and can be arranged online from some of the best medical centers in the world. The second implication is to consider the source of your medical information. Medical science is not always right, and the internet is not always wrong. Yet statistically and in general, information from an unbiased, expert medical evidence-based source is really your best option to bet on. Also, if others recommend treatments contrary to medical experts, check if they are selling you related items for profit. If so, it alone is not proof that they are wrong, but it should be seen and considered a big red flag to investigate carefully and consult with your trusted medical professional prior to pursuing any such option. In sum, it is surprisingly frequent that individuals are not receiving the best options that current medical science has to offer, even for serious medical disorders. Both physician and patient factors are contributory. Finding trusted, up-to-date medical professionals to direct your care and trusted sources of medical information are two of the most important health responsibilities that you face and can have a dramatic impact on your health and longevity. Until next time, this is Insider Med.